Good morning friends. Today I am going to present to you a case of multiple splenic calcifications. You can see that this is the spleen and there are multiple small areas of calcification. This is one area of calcification, another, this is another, this is multiple small 3 to 5 mm size calcification all over the spleen, and these calcifications are occasionally seen on the ultrasound examination by the ultrasoundologist, and they may because the splenic calcifications are rare at times. The clinicians want to know what is the likely diagnosis. Splenic calcifications are seen in patients with infective granulomas, which can be seen in patients with tuberculosis, particularly miliary tuberculosis, in patients with histoplasmosis, in patients with brucellosis, splenic amyloidosis, and they are also seen in SLE, but they are rare in SLE. However, in patients with other diseases, as I suggested, that miliary tuberculosis and in other patients like histoplasmosis, brucellosis, amyloidosis, the multiple splenic infarctions can be seen all over the spleen, and they are generally 3 to 5 millimeters in diameter, as seen in this case. Incidentally, this patient has multiple calculi in the gallbladder also, and this is an incidental finding, but the main important finding was the splenic calcification, multiple splenic calcification. Here I have tried to show you the multiple splenic calcifications, small punctate calcification, miliary calcifications, varying from 3 to 5 millimeters in size. Now we are going to present to you a case of splenic calcification where only 1 or 2 spots of calcification were seen in the spleen. This is the spleen. You can see that this is the splenic artery, and the 2 small foci of calcification which are seen. They can be because of the calcification of the angiomas, or they can be granulomatous calcification in with this patient, and they are different from the rest of the case that I showed you earlier. But this punctate calcification, this is slightly bigger in size, and this is you see 7.4 millimeters in width, and this sort of calcification may also be seen in the spleen. Whenever you see the calcification in the spleen, it should be reported. This patient did not have any calcification in the kidney or in the gallbladder, but the spleen definitely showed foci of calcification. In contrast to the multiple calcifications, the causes of isolated splenic calcification are splenic hemangioma, splenic lymphangioma, splenic infarct getting calcified, and the hydrated cyst getting calcification in the spleen. And the isolated lesion, the isolated granuloma, can also cause calcification. The congenital cyst of the spleen, epidermoid cyst with the wall calcification in the spleen. All these are the causes of the isolated splenic calcification. And whenever you find calcification in the spleen, whether it is isolated and or it is multiple punctate calcification, as we saw in the earlier case, it should be reporting accordingly. Hope you like this video. In case you like our videos, kindly subscribe to our channel. Please press the like button and share the video to the maximum number of people, so that large number of people can be benefited. Thank you very much.